Hello friends, how are you? It's me Kaushiki here again, and today we shall be talking about the lifestyle changes or the pattern that we can follow from the very beginning to prevent cervical cancer or changes which happen in cervix which are precursor to cervical cancer, because I totally believe that prevention is better than cure, and unless you know what are the factors which are related to cervical cancer, you would not take due precaution. So it has been found that human papilloma virus is for all practical purposes a sexually transmitted virus. It is caused by sexual transmission. The sexual transmission need not be penetrative sex. It can be also contacted by skin to skin touch, and 80% of us get human papilloma virus at some point of time or other in our life, and it is cleared off by our immunity, just like our influenza virus is fought off, COVID virus is fought off, and so many other bad viruses are fought off by our immunity. Likewise, human papilloma virus is also fought off by our immunity. There is no medication which will help us in fighting it out. Now, how it is acquired? Obviously, anybody who has got multiple sexual partners, they are more likely to get human papilloma virus. So, anyone who is more promiscuous, they are more likely to have human papilloma virus and thus cervical cancer. That is why it has been found that those people who have got more of STIs or sexually transmitted disease, they also are at increased risk of having sexually transmitted disease. Having said that, it doesn't mean that all those who have got cervical cancer are promiscuous or have multiple sexual partners, but majority of them. So that is one factor. Anyone who starts having sex earlier in their life, they are also at increased risk of having cervical cancer, and the linkage is the same, that it is probably that those who start having sex early in their life, they end up having more partners, and that could be one of the reasons that why there is this association. It is also found that those who have got more children, they are at increased risk of having cervical cancer. Again, the same reason, more frequency of sex, and that leads to cervical cancer. It has also been found that those who take oral contraceptive pills, they are at increased risk of cervical cancer. You will be amused to know that oral contraceptive pill is something which is quite interesting, and it has got an association with various type of reproductive cancers, in the way that it is known to prevent ovarian cancer. It has got preventive role. It has got preventive role in various other cancers, but it increases the chances of cancer, which is cervical cancer and endometrial cancer and breast cancer. So that is why oral contraceptive, though it is quite useful, but it can be associated with few of the cancers as I just mentioned. Apart from that, smoking is something which is associated with increased risk of having cervical cancer. So basically these are the issues. And it has also been found that there is another group of estrogen which is called DES, which is no longer used, diethyl stilbestrol, which was used long back like in 1970s, early 70s, which was given to pregnant ladies in the hope that it will decrease the risk of miscarriage. So the girl child born of such ladies who got DES, they are at increased risk of cervical cancer. So if you have got any of these risk factors, then obviously you need to pay attention, and you are at increased risk of having of acquiring human papilloma virus. And majority of the things which I just mentioned, they are something which one can easily control, easily prevent oneself from having cervical cancer. And most importantly, if somebody is having cervical screening test on a regular basis, then one would be prevented. One more important armamentarium in the whole thing is human papilloma virus vaccine. HPV vaccine is something which has definitely decreased the chances of acquiring cervical cancer and HPV by forming antibodies, and that is something which we will be dealing in our next video. We'll know what HPV vaccines are, who should take it, and other various things which you would be interested in knowing. So if you like this video, do give a thumbs up and do subscribe to the channel. And if you have any health related, women health related queries, do feel free to write it down. If I can answer it directly, I will answer it. If it is something which I find that will benefit the larger masses, then I would make a video as well on it. Until we meet next time, have a good week ahead. Bye bye.